semester of calculus through vector calculus, you have that. 1 semester of linear algebra, you have that, and at least 1 semester of introductory biostatistics courses, which you already mentioned you have. The main part that you need to have are these guys here, the 3 semesters of calc and 1 semester of linear algebra, and the only reason for that is that so that you will have all the prerequisites to go to the math course, which I will describe in the next slide. So the curriculum now is a 36 credit hour curriculum. It's pretty rigorous. What everyone in public health has to take is an introductory course to public health. So basically, it's a course that exposes you to the various disciplines in public health and public health thinking and so on. So that usually is a readings course in public health, like PBHL 510, which is called Introduction to Public Health. There's also a required epidemiology course at a minimum, and there's a course, biostat courses. And in addition, you will have to have 3 credits of thesis research, and we'll talk about the thesis option because we're discouraging it. But it's there, it's in the books, and so on. And one elective course if you decide not to do a thesis and just complete your coursework. For more information, you can go to the website out here, which I will do just to show you. I don't think you can see this, so let me actually stop sharing and share my entire screen so you can actually see exactly what I see. So what I'm showing you is the MS Biostatistics curriculum here, and that link that was that transferred me here was from the actual PowerPoint here. So this link took me here, right? All right, so the required public health course is usually the PBHL 510, which is Introduction to Public Health. It's a readings course. It's rigorous from the perspective it's a lot of reading and a lot of information and so on. So you basically come here the first semester and you just get inundated with this stuff. But it's actually very useful because public health thinking is somewhat different from just technical thinking or even clinical thinking. Then there's also a required epidemiology course, which you can take at pretty much any of the semesters. So you might decide to take it at a subsequent semester. We're going to talk about a plan of study in a little bit. It's called Fundamentals of Epidemiology, and basically it supplements several of the concepts in this course are also going to be inculcated in your head throughout the curriculum, but this also is a complementary course to reinforce some of the concepts in epidemiology. Usually I would recommend taking that course second semester or later, and you will see the plan of study in a minute. So these are 7 courses which you will have to take. The stat, when you see a stat code, that is a course that you must take in the math department. So 519 is essentially a calculus-based probability, and all these semesters of math basically are there in order to allow you to enroll in that course. Now, if you have aspirations to obtain a PhD, especially here, you need to take 519, which is the higher level introduction to probability. It's not introduction to probability 2 or anything like that. It's just taught at a higher level compared to stat 516. 516 is designed for terminal master's degree students. You should not take 516 if you ever want to get a PhD, because it will be kind of waste of time, because then you will have to take 519, which is essentially the same course, just a higher level of teaching and difficulty. The same thing is the case in the spring when you have to take 528, which is the mathematical statistics course. This one has a lower level course, corresponding course, which is called 517. Again, if you want to obtain a PhD in our program, you have to take 528, because if you take 517, you will have to take 528 again in our program. If you think you might not want to continue and obtain your PhD in our program and apply elsewhere, I'm sure they will accept 516 or 517 as probability and math stats elsewhere, because the syllabi are identical. However, in our program, the handbook explicitly states that 519 and 528 must be the courses that someone has to have in order to continue on to the PhD program. With that complicated description out of the way, there is a 4-course sequence, 571, 572, 573, and 574. 571 is basically a regression course. 572 is a generalized linear models course, but really at the lower levels, like a baby GLM. It exposes you to regression models like logistic regression, negative binomial regression, things like that. 573 is a survival analysis course, the Kaplan-Meier-Cox regression, things like that. 574 is an applied longitudinal course. It's basically a master's level longitudinal, first level, lower level longitudinal course, which would be good for people who, especially like yourself, who want to do work in clinical trials, because it explicitly addresses analyses of data that include repeated measurements on people. So usually in a clinical trial, when you have clinical visits, you have all these repeated measurements and you use a special theory to analyze them. We also have a course called PBHL 581, which is biostatistics computing. So you have to take either 581, which is biostatistical computing, or 552, which is introduction to data management. If you want to do, this is the second course particularly useful if you want to be like a master's level statistician in a CRO, clinical research organization, or a clinical trial shop, where you will be required to do some data manipulation and so on. One thing I should say is that our program at this point and at present is based on the statistical software called SAS. And the reason for that is because most graduates work either in the state or in pharmaceutical companies, and SAS still dominates pharmaceutical research and clinical research. The exception to that is course 581, which is an R-based course. So basically, it exposes you to statistical computing with the R package. 552 is also SAS-based, but we have, and we're developing a graduate level data management course based on R. So far, we have only an undergraduate level online data management course based on R, or it's PBHL 452. So here, the goal is to expose you to both SAS and R in equal measure. The prerequisites you see are Calc 1, Calc 2, vector calc, and this one is the lower level linear algebra course. All these are undergraduate course, and these will allow you to get into 517 or 519. And also, in 571 is the prerequisite for everything. The prerequisite for that is any introductory, really, biostatistics course or equivalent. another one. Anyway, so let me just go through a typical study plan. The first year you will take either the probability, for sure, you have to take that. More important, because this can also be taken out here in the third semester, but it's critical that you take 571. If you miss that, you will stay longer than 2 years in the program, because there will be no option of taking that until your third semester. Usually people take 581 or 552 in their first semester. Then you take 57 in the second semester or spring of the first year. You take 517 or 28. You take 572 just because you have to. And then if you took 581 here, you can take 552 here, because that is taught every semester or an elective. And as elective, one of the electives you could take is clinical trials, although I would, which is taught in the fall, so I guess that would go here. So anyway, so this is 10 of these courses. This one is a 4-credit course. It's a 3 + 3, so that's 10 hours here, 10 hours here, and then you go to your fall semester or third semester. So you're going to take either your epidemiology core course or the readings in public health course here, and you're going to take the survival analysis course, and then you can take either an elective, or if you have taken 552, you can take 581, which is only taught in the fall. You can also take 582, which is clinical trials, if you want to stay, but the clinical trials course is taught in R. This is actually the course I'm teaching this fall. So taking this course here without having taken 581 here might be traumatic. So you might want to consider that, and obviously this is a discussion you will have with your advisor. Again, this is a 10 credit hour semester, and then in the spring you take 2 courses, which include either your epi or public health prerequisite, and the 4th course of the 4-semester sequence in biostatistics method. If you want, you can take another course here, another elective, but you can end here with 6 credit hours in the last semester. What else? If you do a thesis option, you can do you can take the B711 in your last semester, which is a 3 credit hour thesis. We discourage that for many reasons. I should say, I'm sorry, the non-thesis option means that at about the end of your third semester, you will have to pass a competency exam. So for example, for people who are finishing this fall, they will have to come in January, a week before the start of the spring semester, and take a competency exam, which basically is based on the curriculum of those 3 first semesters. The competency exam has a theoretical side, so you solve some theoretical problem, and an applied side where you interpret data, because obviously you cannot do analysis live during that exam. You pass that, and you pass these last 2 courses, you graduate. In the thesis option, you don't take the exam, but then you have to find an advisor. We have found that most people take more than a semester to finish their thesis. So even if you start in the fall semester, you may not be able to complete it by the end of the spring semester. So that is also a consideration. For example, I have a student who is in their 4th semester doing their thesis. And I think they will take 2 years to finish it, because it's a very substantial project, and it's a project that is both, it takes a huge amount of time, both of your advisor and of yourself. So that's an option that, even though it's on paper, it is discouraged. That's it. So I'm happy to entertain any questions, Lisa, you may have.